Hi, this is Dr. Tom, and I'm here to talk to you again about the HCG diet. One thing that I have been asked and I'd like to talk about today is metabolic syndrome. Metabolic syndrome is a state that we used to call Syndrome X. We used to always call it insulin dysregulation or being refractory to insulin, or what we call insulin resistance. Now we know that metabolic syndrome has some specific parameters that include things like your total cholesterol, your fasting blood glucose, waist size in men being greater than 40 inches and in women greater than 35 inches. These are all part of metabolic syndrome. What the significance of metabolic syndrome is mainly your predisposition for diabetes in the future. And what I would usually tell people, depending on their age and their diet and exercise, that if they do have metabolic syndrome, it's not a matter of if they're going to become a diabetic in their lifetime, it's a matter of when they will become a diabetic. So something has to be done. Now, one thing that's great about using the parameters of metabolic syndrome is because you have specific areas that you can work on with a patient in order to prevent the onset of diabetes in their lifetime. So the question is that can the HCG diet benefit, improve, or cure metabolic syndrome? Absolutely. Absolutely, because it is all about the storage fat loss. A decrease in the waist size of completely fat loss corrects the insulin dysregulation that people have, lowers the fasting blood glucose, decreases the weight size, decreases your total cholesterol, and even more significantly your LDL cholesterol, can increase your HDL cholesterol. So, and with just the loss of the weight, as well as the loss of the fat, doing moderate exercise and eating better foods, you can also decrease your blood pressure. So, yes, all the parameters that are involved in metabolic syndrome can be corrected on the HCG diet.